fertility is one of your specialties. I would love it if you could give 2 to 3 tips for acupuncturists treating women, though men too, but I do find it still, most of the patients are women.
Yeah.
Give a few tips in treating women trying to get pregnant.
Well, it's going to be one of those haters going to hate, but when it comes to the fertility aspect, and again, as you said, rightly so, more so the female side, which is what I would deal more with, we really need to work together, because a lot of the times, even if we're looking at it from, the best Chinese medicine diagnosis, the best facial diagnosis, there could be something underlying there. We know so much more now about immunology and how the reproductive immunology side of things can affect the woman, and not many signs or symptoms might be out there. And I know people can be listening to this now and say that the purists, let's call them that way, and say, but if the problem is there, you will find the symptoms and you'll be able to treat them. And I would tend to agree with that.
Mm-hmm.
The thing is, it'll take you a lot longer. Whereas if you just look at the lab results and you find something, you can address it straight away. And you can address it in your own Chinese medicine perspective.
Right. It's more information.
Absolutely. So that would be my very first, just because of, from the very start, yes, I come from traditional Chinese medicine, from the Zhang Fu kind of school.
Right.
So yes, I sometimes I was able to get there, sometimes I wasn't. It happens to everyone in the clinic. But learning from my mistakes would be one thing that I would say, the sooner the better for anyone in clinic. Just be open. Ask the woman to go to their MD or to their GP if you're watching this over this side in Europe, and just ask for the tests and just do them. Because remember, like anything in medicine, you're not looking for something wrong. You want to make sure everything is right. From the perspective of the other side, I always say this to the woman, look, ultimately, I'm not looking at the person and the wanting and the trying to get pregnant. I'm looking at that person pregnant and carrying the pregnancy all the way through.
Yes.
So I want that person as healthy as possible, not just for the trying, but also for the pregnancy. So when was the last time that you had bloods done? Oh, I'm always healthy and never have any problems. And yeah, just because you're not sick doesn't mean that you're healthy, right? We all know that saying, right?
Yes.
So I would say, look, is it more than 6 months? Is it more than a year? And if it is, or I can't even remember, well, then just go and get them done anyway, because it's your health. So you're not doing them because of me. You're doing it because of yourself. You're doing it because of the pregnancy. Like with the labs, it's, I will explain it, for example, with what you were saying with the blocked tubes. You made a very good point. What symptoms in Chinese medicine whatsoever are you going to see in the clinic from a woman with one or both tubes blocked?
You might see a few, but it's not going to be enough.
And again, how long is it going to take you to get to that conclusion, whereas someone can just do it with an ultrasound scan in a few minutes?
No, so that's why I agree. Go to your GP. Get the test done.
Say, even if it's one of those GPs would be a little bit more like old school and just, no, I'll do them, but I'm not going to share them with anyone. Just ask, what is the figure? What was the end result? Because everyone's going to say, oh, they were okay, they're within range. But we all know, I always give the example of the iron, for example, independent of what the numbers are between the US and Europe, you have the range. But if you have someone just on the green, normally I say it to people in clinic. So if you have an iPhone, you know that when it goes below 20%, the battery goes on red.
Right.
So if it's on 20 or 21, it'll be green. So would you leave the house with it at 21%?
That's a great analogy.
And everyone goes, well, no, because I would have to charge it because it will go down straight away. So, well, that's the same as your iron. So if you go into pregnancy, like in our case here, I don't know the numbers for there, but like you're looking at 9, 10, if you go into pregnancy with 12 or 13, surely within the first few weeks, you're going to be on the red zone. Yeah. With FSH levels, the clinics here, I know that the numbers are different, but for most of the clinics here, and in Ireland and the UK as well, they don't want to see anything higher than 8. So they don't want to see a double-digit number.
See, maybe they've lowered it, but the last I heard it was like you don't want it above 10. But see, even way, you don't really want it at 9.5 either.
Yeah, absolutely. Yeah, absolutely. So it's those little things. And sometimes, I go to the simple ones, like with the iron, just because of making it that this is not even about the hormones. Right. This is just about you will feel better if you're, are you tired more often? Just, help supplementing that iron a little bit. And you're then getting into your 13s or 14. So within the first few weeks of pregnancy, you're still on the green. So if you leave your house with the battery on 40%, right, it'll take you longer to hit the red. So that would be, for the practitioners, I would say ask them to do the tests anyway. And if there's any of the practitioners that won't share those with you, just get the patient to ask, I know they are okay. What is the number? Am I too close to any,
let me ask you this. What would be the top 3 numbers? Like if I say to my patient, I want to know these 3 things, okay? What would you say would be the best ones? Because like blocked or unblocked, that's not too hard to get.
In terms of the blood results, you mean like which ones would you be looking for? Well, for here in Ireland, we always ask for vitamin D. That's because we don't really get much of that one.
No, but that's true in Chicago too. So many people are low in vitamin D.
Yeah. I would be careful with the combination of the two and see where the 2 numbers are. So if I'm allowed, I'll put the 2 together, the iron and the B12.
Okay.
And then you're going to pick one of the hormones. And just to show you how much more functional and broad I would be, and this is not me being super, this is just from the years of practice. If I would pick one of the hormones and one of the things, I would go with the thyroid function.
Oh yes, because so many people, but so those are all ones I completely agree with you on. What about things like FSH or AMH or any of those things?
So the just reminds me that a couple of years ago I was interviewed for a podcast in Israel, and the girl said that you can be as controversial as you want because it'll actually be good for the readings. And now I'm thinking, oh my God, do you want me to talk about AMH? Okay, so AMH, is it really that important in the clinic, even for the fertility clinics? Not really. Yes, because it's a good predictor of response to stimulation. So it kind of gives them a better idea of how
they'll respond to the drugs.
Yeah.
Okay.
AMH is not your egg reserve.
Right.
Like feeling like saying this in the clinic, like at least 2 or 3 times a day. AMH is produced by the granulosa cells of the follicle. So obviously if you have more follicles, that AMH is going to be higher. If you have less follicles, that AMH is going to be lower.
Right.
And if someone's AMH is already on the slightly high side, as you know, obviously if that AMH is quite high, that could be one of the first clues on your multifollicular ovaries or the polycystic ovaries.
Right.
But even if that number is already on the slightly high side, you don't want to be, even as a Chinese medicine practitioner, you don't want to be stimulating too much.
Right. Right.
The same way that for the clinics, I don't want to give them too much medication for stimulation because they might overstimulate.
Right.
So the AMH, would I do it? Yeah, eventually down the line, yes. But FSH and LH, definitely, yeah. I would call upon those first.
I always thought FSH was so important, but then I don't know why, but recently, I've at least, again, because we don't have a lot of communication with the doctors, I hear a lot from patients where patients are telling me, oh no, now they're saying the AMH is what's important.
But Jennifer, think of it this way, and let's put ourselves on their shoes and think they are the ones who are going to give these women strong medication.
Exactly. So to them, it's very important.
Absolutely. Yeah.
Right. But you know what? I appreciate that because until this discussion, it did not really occur to me. Because I didn't understand they were also using the AMH as a way to gauge medication. Yeah. So of course it's important to them, but FSH is still very important for determining where the woman is at. And
Absolutely.
the way it was being reported to me by patients, at least, and again, that's, you know, you only get so much,
Yeah.
is just, oh, it's important, it's important. And that makes so much sense, what you just
Yeah.
said. And it's such a good point.
Yeah.
And it's interesting too. I wonder if in America they've lowered the number or not, because I used to always hear you want it below 10. So it's interesting in the UK, they're saying below 8, but maybe America's changed the standards.
Yeah, some of the clinics still look at the double digit number as being the red zone. The ones that look at the 8 is just really for as they say here in Ireland, to be sure, to be sure.
Okay.
You know, again, it's those minor differences. I would imagine that, for example, if there's someone there, again, it's all relative, isn't it? If
Yeah,
there's someone there with a 9, but they're late 30s, early 40s, that's different from a 9 if you are 25, you know.
Right.
So it's always going to depend on the person a little bit, but and the history of the person.
Right.
You know?
And all the
So,
other things going on in their body.
absolutely. Yeah, absolutely.
Right. I know. I totally agree. Okay. So the first tip,
Mm-hmm.
just to shorten the version of it, I took
Yeah.
notes, by the way, is your first tip for acupuncturists treating fertility is tell the patient, go to your MD, go to your GP,
Yeah.
get basic blood tests done, including vitamin D,
Mm-hmm.
iron, B12, and then FSH and LH.
And if at all possible, the TSH thyroid test is very, very important.
Okay.
And there's two aspects of that, if I can add to this now. So number one, because you're looking at them getting and staying pregnant.
Right.
So thyroid function will be very, very important because
Yes.
you want to make sure that metabolic
Yeah.
rate is as good as it
I
can be.
always have them check their thyroids.
And number two, so imagine that that's all you do in the clinic. So you only see women, and you only see women who are trying to get pregnant, right?
Mm-hmm.
So in 10 years of practice, you've developed this amazing practice, and you can now tell everyone that, look at me, I have this very successful method of treating women, and I know what to do, when to do it, and it works all the time. And I say to you, wow, that's really, really good. Can you show me the results? Can you show me what has changed? If you have the baseline tests
Okay.
that you can then go and compare,
Yes.
then you can then say, yes, I do, by the way. Because, you know, if you say to someone that, well, when they came in, they had, you know, liver fire rising, whatever, and now they don't anymore, I don't really know what that means. But if you were to show them the baseline tests,
Yes.
and then show them where they are, you know, X amount of months or years after, you say, there's a physiological, measurable way that I can show you that they have actually changed.
No, I think that's great, because what I usually look for, have my patients look for, is changes in their cycle and seeing their cycle regulate and the blood change and all of that. But no, this is great. As I said, took notes, and I have learned something. So thank you. This is a great first tip. Do you have a second tip?
I would have a second tip, and I'll pay my respects to. I always like to pay the respects to everyone that was there before me, because, as I said to you, I studied traditional Chinese medicine, the purest form, Zhang Fu way. So it's all very. I honor those. So to have a little word to someone who left us here almost going on 2 years now, but the great late Ray Rubio said once that patients don't care how much you know until they know how much you care.
Yeah, that's true.
And I always like that. Again, I'm going on people who were influential, you know, influential for me growing up. My granddad would have a lot of those sayings as well, and that always stayed with me. And yeah, Ray would say that at the end of the day, you're in the clinic and you're trying to do all the mechanisms of making the person better. Doesn't
right.
At the end of the day, Jennifer, is it traditional? Is it ear acupuncture? Is it electroacupuncture? You're trying to get the person better. And yeah, the reality is it shouldn't even matter, and it should be like that. And to there's a lot of teachings from Ray, but one of those that stayed with me is that, you know, just be caring and be the best practitioner that person can get at that particular moment. And a lot of the times, you know, the plaques on the wall and the certificates on the wall and how much you studied and how much you know, it doesn't really matter for the patient. They just want to know, can you help them?
Right. And they want to feel compassion,
Yeah.
or they want, I think that's so true. And especially when you're dealing with patients who are having
Absolutely.
fertility challenges.
Yeah.
I think that's very true. So I would agree with that. Any other tips you'd like to impart to acupuncturists?
For acupuncturists, where are my notes? Because you were looking at your notes. Oh yeah, I do. I do actually have. I do have a third tip, and that goes on the same tip I gave you when we were on. I can't remember if it was being recorded or not, but that is just do something. You know, just do something. Even if you're unsure with the symptoms, just go with the one that is affecting the person a little bit more. Go with the one that is just really in the way for them.
Start with what you know you see.
Absolutely. Yeah. So, but just don't just look at that goal of it has to be because of the pregnancy. It has to be because they want to get pregnant. Maybe the most important thing at that particular time is just that they're not sleeping well.
Right.
Maybe it's just because they are not eating well, or that digestion is not great, or they're not feeling enough energy to do what they need. And it might not be the right thing for them to do, but it might be what they need to do at that stage. So just go with it, do something. And again, it kind of links with number 2, but it's just do it. Just go for it.
Yeah, I agree. And as you gain your patient's trust, they'll probably feel more comfortable if you want to try other things.
Yeah. Oh, listen, Jennifer, how many times have you been in the clinic and then like 3 or 4 weeks into it, it's like, oh yeah, by the way, you've asked me before about the sleep and I kind of said that it was okay, but in reality, I wake up a lot during the night.
Right. Or, you know, I am kind of stressed, or I realized, I've been getting headaches every day and I only have a bowel movement once a week.
Yeah.
Yeah. I would agree with you on that too. There's so much agreement.